Hello, my name is Andre Adams. This is going to be a presentation for CAP480 titled An Alternative Approach to Cost Containment. While this presentation is geared primarily towards administrators and future private practitioners, the truth of the matter is there is no such thing as a one-man or woman team. Alright? In fact, all members of trained staff can benefit from the knowledge contained here, not just the ones that have the authority to make policies to enforce it. Healthier patients reduce medical expenses. Bottom line. When we positively influence our patients' health through education and prevention practices, everybody's going to benefit. For the institutions, it translates into positive revenue, better wages, and ultimately continued business. For the consumer, this means less money out of the pockets to pay for healthcare expenses. If I had to give this a specific purpose, it would really just be to raise awareness that involvement in the promotion of preventive medicine is an effective strategy at mitigating the effects of high healthcare costs. Moving on, I've got a lot to cover here, so we'll be going kind of brief, so bear with me here. Alright. The average American incurs roughly $16,000 in health expenditures every year, with about a quarter of that being paid by workers through employer-based programs, so let's call that about $4,000. If we could shave off only a quarter of this, heck, if we could shave off a few hundred by making some really relatively uninvasive steps, think about the impact a change like this would have across the board. Exciting and plausible stuff. Prevention and education are the channels by which we can make this change occur. Prevention is exercised through access, annual checkups, and an increased use of office visits as opposed to ER usage. Education, facilitated not only on the part of insurers, but that of practitioners and service providers on all levels, meets this measurement of need. Together, these two venues may not only reduce healthcare costs for the average family, but offer the entire sector with widespread and consistent use. Alright, it's just a matter of getting everybody on board. Let's first premise this by the fact that preventive medicine is a strategy that will have an impact on all health expenses, be it through a reduction of costs or by staggering up its rise. The aftermath of such an implementation can be positive in either regard. The practices of prevention are not foreign, and it's in fact gained some popularity over the past year, especially with the reform and all that. It's definitely gained some popularity as an option. But a system needs to be in place in order to facilitate its practice. On the angle of education, we've all been in those office waiting lobbies where they're littered with like pamphlets, and you got these posters to do this, don't do this, you have this if you have these symptoms. We've all seen this before, but aside from being something to kill the time, little of this information is actually retained by patients or their families. Unless you're the guy that has what it says you don't want to have. All this begs the question, how do we make these two houses of thought come together? History has proven that preventive actions are superior to the reactive actions most of us take when we are in need of medical services. Right? It's always wait to the last minute for us. With the barriers to access, cost, availability, many patients opt for use of emergency rooms than that of routine office visits. Why? Because most of the population that uses medicine in this way simply can't afford the office visits. Either they have no insurance, they can't pay the deductible, you name it. I mean, there are definitely barriers to access. The problem with this strategy, the practice of using emergency rooms, is they tend to be a lot more expensive than actually going to the office and getting checked out and catching something early. Even if the impact of cost that preventive medicine could be overlooked, what about the productive years that could be recouped by having those individuals alive that otherwise would not be through the use of intervention? About your price tag, you just can't measure that. I mean, someone that would be alive because they didn't get cancer or they didn't get diabetes, just to name a couple. I mean, you name it. I mean, a lot of our patients, a lot of people in our field die because they don't get that preventive medicine, and we just lose years out of it. You can't put a price tag on that. Moving forward, in regards to emergency room overutilization, think about the costs associated with waiting to the last minute. For example, an average emergency room visit costs somebody $1,233. Of course, insurance holders may see a reduction in this number, but we're still looking at something that's I mean, 40% higher than the average rent. I mean, you're looking at 837 is the average rent. I mean, 1233. Most people, I mean, you'd have a hard time making 2 or 3 ER visits a month. Think about if this happened 2 or 3 times a year. And with 48 million Americans still uninsured, that's $59 billion that someone has to foot with if they just took 1 ER visit. 48 million Americans. If they all just had to go to the ER once, you're looking at $59 million. It's gotta tell you something, right? Okay. With the primary source of this type of expenditure being lack of access to quality healthcare, even a fraction of the surplus created from these savings would allow programs to be opened up to accommodate these less fortunate parties. Further, it should be noted that this is not only reflective of the uninsured and not taking account those that have private or employer-based coverage. What we could be looking at here is a net savings that would not only reduce costs for everybody, but open up the availability of professional care that some were not privy to by other circumstances. I mean, just with this extra money we'd be saving, it's going to open up a lot of doors for a lot of people. Which brings me to my next point. The utilization of preventive practices can only take us so far. Just like companies train their employees to be proficient with tasks, we must educate our consumers about healthier living through active education. And when I say active education, it goes beyond just having, the pamphlets all over the lobby. It goes well beyond that. It's more geared towards driving into the conscious mainstream of the public we serve. And there are really many mediums we can do that with. Word of mouth, television advertising, free information dispensed by insuring parties, you name it, just about any form of communication can be harnessed to disseminate this needed information to the people that need it most, our consumers. When I ask, what do high sugar diets lead to? About anyone's going to be able to tell me diabetes. This is either because they have heard it from someone else or have been exposed to some other medium that educated the user. Proof that it does work. So how do we get everybody on board? Government's going to have a role here. You can do extra taxes on products that have inherent risk factors. We know tobacco, alcohol, certain prescription pills. Marketing campaigns that discourage the use of such drugs and have special incentives to service providers for participating in preventive practices can encourage institutions to more readily accept the change. All right, there's lots of government incentives that can be thrown into there. Employers that offer employment-based coverage can offer incentives for maintaining a curriculum that facilitates healthier living practices. Introduce health questionnaires to staff to identify habit-forming or risky behaviors. Promote screenings, usage of their coverage. This saves the insuring body money by preventing preventable diseases, which can be put back into these companies in the form of lower wages and such. In conclusion, there are a lot of preventable ailments out there. There really are. And a lot of it's, hey, most people, if you tell them you're going to save them money if they just use this instead of using real sugar, or try alternative smoking habits, because tobacco is really the second leading killer, well, at least in the U.S. I'm not sure if it's still in the world, but it is in the U.S. There are many things that we can do that can curb this inflation, because healthcare costs are getting out of control, and it's really through prevention, lifestyle changes, education, that we're going to be able to stem this tide. So I thank you guys for listening. I hope that wasn't too hard to follow. I know I was trying to speak really fast in 10 minutes, but my name is Andre Adams, and have a good evening.